Lymphoedema is a condition which manifests as chronic swelling, usually considered to be fluid swelling, but it's a bit more complicated than that. And it can arise for a number of reasons. Firstly, for example, after breast cancer treatment, which is probably the best known example of lymphoedema. It gives rise to swelling, usually in the upper limb, but it may be limited to a hand, or it may be limited to some area of the chest, including the breast. And that's called a secondary lymphoedema because we can identify the cause of it, in other words, the breast cancer treatment. But there are many other circumstances where lymphoedema can develop.
Lymphoedema will develop where there is either too much for the system to cope with because there's extra fluid in the system, or where the capacity of the system has been reduced and therefore normal flow is too great for that system. And in the case of breast cancer related lymphoedema, it's usually a combination of both. The lymph system has had its capacity reduced by either removing some of the lymph nodes or just going in and sampling them and therefore damaging some of these tributaries. At the same time, quite often the demands on the system are greater because either they're having additional chemotherapy or the demands in terms of activity, exercise, and all the rest of it puts extra fluid into the system and therefore has to be dealt with by a reduced capacity system, and swelling can result. Lymphoedema is not a collection of fluid, it's in the tissues. It's a bit like honey in a honeycomb. You can't draw it off, or if you do, you take one out of each little globule, and as fast as you do that, the body is naturally producing more. This is a diagram just showing basically the lymph system. On one side it's showing you the superficial, the other the deep. All of the drainage from the arm goes through the lymph nodes in the armpit. However, because there are drainage routes that go across a bit like the country network, the main roads for getting from A to B go through these motorway junction stations here. But you've actually got country roads that will cross over, they're just slower. So for the trunk, for the breast area, there are more drainage routes across, but for the arm there is really only the one way through.
The risk of lymphoedema is about 1 in 4, which is quite high. Oncologists would consider the risk to be less, and I think that's a perceptual thing. It also depends on when have you got lymphoedema and when haven't you got lymphoedema. There's no doubt that we're seeing much less severe lymphoedema than was the case 15, 20 years ago. And I think that's due to better awareness, picking up patients at an earlier stage and treating them more effectively. And it's also due to some extent with more breast conserving surgery, less invasive surgery, and that too, if not reducing the total risk, is possibly reducing the severity of lymphoedema. I think there's a belief that with the introduction of sentinel node biopsy in the management of lymphoedema, in the management of breast cancer, that lymphoedema might disappear. I'm confident that won't be the case. Yes, that it might reduce the risk, but it's not going to take it away altogether. And the reasons for that are simply that any intervention to lymph drainage runs the risk of lymphoedema. And if it's not going to be 1 in 4, then it might reduce to 1 in 10 or even 1 in 20. But it's going to be there. If you're the 1 in 20 affected, you want to make sure that there's good treatment available.
Anyone who has had any interference to the axilla, whether through surgery or radiotherapy, and surgery can be sampling of the lymph nodes, can be full-blown mastectomy with or without major clearance of the lymph nodes. So any interference to that area puts somebody at risk because it damages the drainage system. We don't know who therefore will develop lymphoedema. All we can say is that if you've had treatment, you are at risk. Whether you'll develop lymphoedema or not is completely unknown, and I think is dependent on what your initial drainage system is like, which nobody can tell.
Well, once a woman has had breast cancer treatment, and because the lymph route has to be interfered with for the purposes of diagnosis, staging and treatment of the breast cancer, they are therefore automatically at risk of lymphedema. I mean, even with developments towards what's referred to as sentinel node, which is literally just trying to take out one lymph gland, that does not stop the risk of lymphedema. It might be less, but it's still there.
And the one bit that I think is probably the hardest for most people to accept is that swelling risk is lifelong. Having had the cancer treatment that's taken out the lymph nodes and therefore damaged some of the lymph vessels, those don't regrow. Can't put back what's been taken out, and therefore it will be a lifelong risk.
Yes, well, of course, men can get breast cancer, not just women, and because the treatment is the same, then they too are at risk of lymphedema. And while these numbers will be many fewer than women developing breast cancer-related lymphedema, there is a significant number of men, and they shouldn't be forgotten. And their needs, particularly psychologically, may be different from the women that suffer with breast cancer-related lymphedema. Nevertheless, the treatment for the lymphedema is going to be the same.
I think there's a lot that people can do to not prevent it, but to reduce their risk. I would hesitate to use the term preventing, because that would imply some burden of guilt, I think, if people then later do develop lymphedema. But there are things that people can do to reduce their risk and to equip themselves and their lymph system to cope with normal day-to-day life and the burden on the lymph system. So the earlier that people can get into that routine of doing practical measures like looking after their skin, avoiding as far as possible the risk of infection by not putting yourself into risky situations. For example, wearing oven gloves when using the hot oven, putting on gloves when you're gardening, particularly when you're dealing with roses. So there are very practical things that can be done with skincare, and as simple as putting on a moisturiser every day just to give the skin as good a chance to protect against cuts and grazes. I personally believe that the role of exercise is very important in reducing your risk, in that if you can train and condition your muscles to cope with the day-to-day demands, then when you put extra demands on it, then your body is better equipped than if you are just sitting around avoiding any kind of activity. And then the third area is living as healthy a lifestyle as possible, keeping your weight within normal limits so that you don't overload the lymph system, getting as fit as possible so your body is in as good shape for whatever demands that you're placing on it.
So when women have been treated for breast cancer, they should be informed about the risk, and in terms of what they can do for themselves, it's issues such as being aware of excessive strain on the limb will increase the risk of lymphedema. Being careful that any skin damage which might allow infection to enter would increase the risk of lymphedema. There are simple measures that are given to all breast cancer, or should be given to all breast cancer patients who are at risk of lymphedema, in terms of risk of insect bites, risk of abrasions, cuts, bad sunburn, all these issues which can increase the risk of infection and thereby trigger a more long-term swelling.
So this is all about managing risk. You're at risk of lymphedema, how do you manage that risk? So go away, think of the different activities that you do and what is the impact of those activities, and can you find a way around doing them differently, different intensity for the same effect, and which ones are important enough that you want to carry on doing it. There are two main points of access in addition to the patient's own personal breast care nurse and doctor, and that's through the Lymphoedema Support Network, which is a patient group run by patients for patients, and also through the British Lymphology Society, which is a healthcare professional group and has a directory of services throughout the UK. When I started as a lymphedema specialist in 1990, the availability of treatment was very poor throughout the UK. There were probably a few centres attached to specialist cancer services, largely run by interested healthcare professionals, nurses, physios. The situation now is very different. There is still not enough lymphedema care, but it's very much more widely available, largely through breast care nurses, physios attached to cancer services, lymphedema nurses, but there are also more medics. As a lymphedema specialist, personally I think the earlier that they're aware of it, the better, but not so that it interrupts their post-op recovery, their concentration on the important issues to do with cancer, its treatment and, as I say, recovery. There's a lot of debate in specialists as to what point you introduce the concept of lymphedema as something that people need to consider. And traditionally, people try to, as healthcare professionals, let them know within the post-op period before they leave hospital. I think as long as people are given information, even if they don't fully understand their risk, at an early stage, so that when they go home and then start to think things through, they've got a point of access that they can refer to, either written material or somebody they can go back to ask.
Well, patients that are concerned about the risks of lymphedema, and that may be at the time they're having their breast cancer treatment or soon afterwards, should seek the right advice at that stage, even though they may be still suffering concerns about the cancer itself and suffering the effects of the treatment they've had. Because to be informed is to be aware and is to be prepared in the eventuality of any swelling development. So I don't think there's too early a time in terms of being informed about lymphedema. Well, early symptoms of lymphedema usually are a heaviness or an aching or a discomfort, not necessarily pain, but a discomfort in the limb. And that will usually come either before or at the same time swelling becomes visible. The swelling and its distribution may vary quite considerably from patient to patient, which is also a bit of a mystery. And some patients will find that their hand swells but there's no swelling anywhere else. Conversely, another patient will find that the forearm and elbow area are both swollen and yet the hand is relatively spared. So it does vary greatly from one individual to another as to where the swelling might develop. The other thing that can happen is that they can get infection. Because the lymph route is important for policing or patrolling against infection, then a patient may actually present with a painful red swollen arm, and this represents an infection which needs treatment, but the fact that they've had an infection may well trigger or manifest more chronic swelling as a result. Indeed, the relationship between infection and lymphedema is a close one. Infection can trigger lymphedema, but equally lymphedema can predispose to infection. So it's not unusual to get a vicious cycle of infection, worse swelling, more infection, and that vicious cycle has to be broken, not only with the treatment of the lymphedema, treatment of the swelling, but with avoidance of the infection.
I think it's important that people are very aware of their own bodies, but they need to remember that the body is a whole. When they've had surgery or radiotherapy or a combination to one side, there will be natural alterations. If part of the breast or the whole breast is removed, automatically the shape changes. The tissues will fall in a slightly different way from what they did before. So we're not comparing anymore like with like. Even with breast reconstruction that aims to produce a match, it's still not exactly the same. It doesn't respond in exactly the same way. However, having said that, if somebody is concerned whether they have swelling or not, they do need to compare the sides. Factors that will influence that, we've had people that have presented to us before feeling that they have swelling, but in actual fact they've put on weight. So both sides have increased, but they've only focused on the affected side and not realised that actually the clothes are tight on the other side also. So it is worth bearing in mind, what is my weight doing? If you lose weight, equally, size will change. Muscle toning, if you are more or less fit than what you were before, the muscle shape will change, and that will also alter how you feel you look. So I've had a lot of people who've said to me, I've got swelling under my arm, but when I pull it into position as if they'd got the breast still there, it's kind of, oh no, it's gone now. Because it's not actual swelling, it's just that the tissue relaxes into a different position and you're not used to having it there. So that's question number one, is it swelling? Or is it just that the tissue's in a different place because it's not now tethered in the same way by the breast? Or is actually, has got scarring in it that you didn't have before, so it feels different. The other thing is that because often the nerve sensation is affected, the sensation is of swelling, when actually it's that you've got altered sensation. You know, you'd be to the dentist and you have an anaesthetic, you feel as if your face is out here, and yet it isn't. It may be mildly swollen, but it's often not enough even to see. But because the sensation is changed, when you touch it, it feels different, it feels larger, it feels more swollen. If your sensation is altered in the back of your arm, which for a lot of you it probably will be, it will often feel swollen, regardless of whether it is or isn't, just because the sensation is altered. In the end, a lot of it is dependent on how you feel inside the tissues, as well as how it looks outside, and if in doubt, it's best to go to a healthcare professional and ask. They shouldn't treat you as if you are wasting their time. It's a valid question after somebody's had breast cancer treatment. If they feel that their arm is heavier or larger, or the breast is heavier or larger, or the areas around it, to present and ask the questions is perfectly reasonable.
Yes, some patients are actually unaware that they've got lymphedema, and it's only when we examine them and look at the changes in the skin or measure some objective difference between the two arms that we're aware that they've got lymphedema. Equally, patients can perceive they've got lymphedema where there may be no lymphedema, and one example is in the upper part of the arm here, and this area frequently goes numb because of the necessary severance of an unimportant nerve in the under the arm. Well, under those circumstances, that perception of swelling may need some reassurance. It may need a check by a healthcare professional to prove that there's no swelling there. And indeed, that perception of swelling due to the numbness may change over time as some recovery may ensue. It's not unusual immediately after breast cancer surgery to develop what's referred to as a certain amount of post-operative swelling or edema. And that may last anything up to 3 months and then disappear, and the patient may have no further problems. On the other hand, patients may develop post-operative swelling which simply persists and progresses into more chronic lymphedema. And it's very difficult to know the significance of that early swelling as to whether it is just the effects of the operation or whether it's an early lymphedema that somehow has managed to rectify itself. So these sort of questions at the moment we can't easily answer, but hopefully if more research is done, then we will understand more clearly about the mechanisms that give rise to breast cancer related lymphedema, and may be able to do something more about them at an earlier stage,